Artificial Intelligence Doctor. Cognitive activity and autonomic nervous system regulation in pacemaker patients. Question: how does cognitive activity, thinking, talking, affect autonomic nervous system regulation in patients with single-chamber ventricular pacemakers, and could this interaction cause perceived discomfort? Answer: the interaction between cognitive activity and autonomic nervous system regulation in patients with single-chamber ventricular pacemakers is a complex phenomenon that can indeed contribute to perceived discomfort. Here's a comprehensive analysis. 1. Normal physiological response to cognitive activity. During cognitive tasks such as thinking, problem-solving, or engaging in conversation, the body naturally experiences sympathetic nervous system activation, increased heart rate, blood pressure, and cardiac contractility. Altered breathing patterns, often more shallow or irregular breathing. Metabolic changes, increased oxygen demand and glucose utilization. Hormonal responses, release of stress hormones like cortisol and adrenaline. 2. Single-chamber ventricular pacemaker limitations. Single-chamber ventricular pacemakers, typically VVI or VVR modes, have inherent limitations that become problematic during cognitive stress. Loss of AV synchrony. The atria and ventricles don't coordinate properly, reducing cardiac efficiency by 15 to 25%. Fixed or limited rate response. VVI pacemakers provide a fixed rate, while VVHR models rely on motion sensors that may not detect cognitive stress. Retrograde conduction. Ventricular pacing can cause blood to flow backward into the atria, creating hemodynamic inefficiency. 3. Autonomic pacemaker interaction during cognitive activity. When patients with single-chamber ventricular pacemakers engage in cognitive activities, several problematic interactions occur. Hemodynamic mismatch. The autonomic system demands increased cardiac output for brain perfusion. The pacemaker cannot adequately respond to this demand due to its programming limitations. Result: inadequate cerebral and peripheral perfusion. Pacemaker syndrome manifestation. Loss of atrial contribution to ventricular filling, atrial kick. Activation of atrial stretch receptors due to retrograde conduction. Inappropriate vasodilation and hypotension. 4. Perceived discomfort and symptoms. The autonomic pacemaker interaction during cognitive activity can cause several uncomfortable symptoms. Cardiovascular symptoms. Chest discomfort or pressure due to reduced cardiac efficiency. Palpitations from irregular atrial activity or retrograde conduction. Shortness of breath. Inadequate cardiac output relative to metabolic demand. Neurological symptoms. Lightheadedness or dizziness. Reduced cerebral perfusion. Cognitive fatigue. Brain working harder with suboptimal blood flow. Difficulty concentrating, creating a feedback loop of increased cognitive effort. Systemic symptoms. General fatigue. Inefficient cardiac pumping. Neck fullness or pulsations from retrograde conduction and elevated atrial pressures. Exercise intolerance, even for mental tasks. 5. Contributing factors. Several factors can exacerbate these symptoms. Pacemaker programming, inappropriate lower rate limits or lack of rate response. Patient's underlying autonomic function. Some patients have heightened autonomic responses. Medication effects, beta blockers or other cardiac medications. Individual sensitivity. Some patients are more aware of hemodynamic changes. 6. Clinical management strategies. To minimize discomfort during cognitive activities. Pacemaker optimization. Adjust lower rate limits. Enable rate response features if available. Consider upgrade to dual-chamber pacing DDD/DDDR to restore AV synchrony. Medication review. Optimize heart failure medications and avoid excessive beta blockade. Patient education. Explain the relationship between mental activity and symptoms. Behavioral strategies. Pacing mental activities. Relaxation techniques. Important clinical note. If a patient with a single-chamber ventricular pacemaker reports discomfort during cognitive activities, it's essential to evaluate for pacemaker syndrome and consider whether the current pacing mode is optimal for their lifestyle and autonomic function. The symptoms are real and physiologically explainable, not psychological. Conclusion: Cognitive activity can indeed affect autonomic nervous system regulation in patients with single-chamber ventricular pacemakers, potentially causing significant perceived discomfort. This occurs due to the mismatch between the body's physiological demands during mental stress and the pacemaker's limited ability to respond appropriately. The resulting hemodynamic inefficiency, loss of AV synchrony, and potential pacemaker syndrome symptoms create a constellation of uncomfortable sensations that can significantly impact quality of life. Understanding this interaction is crucial for healthcare providers to validate patients' experiences and implement appropriate management strategies, which may include pacemaker reprogramming, device upgrade, or supportive measures to optimize the patient's cardiac function during cognitive activities.